Lastly, what kind of advice do you give to patients in the post-transplant phase, when it comes to things like infection prevention, them looking at, you mentioned pools and pool environment, that's a great example, or even going to the gym, joining some group classes. So how do you kind of arm them to make sure that they can make the right judgment in terms of managing that post-transplant phase?
Yeah, and again, partly the risk profile does depend on how far down the track they are after their
Mm,
transplant. But certainly, at any point we'd say looking at for a clean environment. If you look going into a gym that's really, really busy, lots and lots of people in there, particularly when we've got that seasonal
mm,
respiratory viruses floating around, maybe that's not the right time to go. So it might be the right gym, but actually just done at a later session or an earlier session when there's less people there, for example. So you do want to make sure the environment you're going is clean and well ventilated, using gym equipment, wiping it over before and after, just as we train people to do,
mm.
pre-transplant, and then in the rehab gyms
Yeah.
after the operation, that continues into community gyms as well. So wiping over the equipment before you use it, as well as after you use it, is really, really important. Groups can be a great environment, but again,
Mm,
just thinking about, how's that group run? Where's it run? Is it an outdoor walking program, for example, which is going to be, a lower risk than an indoor group session, for example? Do people rock up to that group when they're coughing and sneezing and all the rest of it? Or, is the group pools pretty well maintained? People stay home if they're sick. So every situation is a little bit different. But you do want to be mindful of, those environments that give you an increased risk of respiratory viruses. And is there ways you can mitigate that risk as best as possible?